The numbers are staggering. 3.4 million pills entering Ohio between 2006 and 2012. 358 million opioid doses across Cuyahoga County and 212 million more in Summit County, killing more than 4,000 Ohioans between 2011 and 2017. And now those two counties will receive millions of dollars from drug distributors and a drug manufacturer for their alleged role in contributing to the opioid addiction crisis.
A settlement was announced this morning just before opening statements were set to take place in the federal court. This was expected to be a bellwether trial involving not just these two counties, but thousands of communities across our country. We have team coverage tonight breaking it all down for you, and we begin with News 5's Olivia Fecteau live at the federal building downtown. And Olivia, county leaders and their attorneys say this money will be available right away.
Yeah, good evening. The counties say even if they had gone to trial, even if they'd been able to get more money out of it, they say that money could have been held up for years during the appeals process. Now they say they'll be able to direct this money to help people affected by the opioid crisis immediately.
We need the money on the streets helping people today. That's what this settlement does.
Leaders from Cuyahoga and Summit counties, joined by their attorneys, say that's what motivated them to settle with 4 of the 5 defendants in a trial that was set to start today. That also meant turning down a potential settlement that would have resolved thousands of lawsuits filed by communities across the country.
They were talking billions of dollars paid in trickles.
Instead, the counties say they hope this settlement will be the benchmark for any future settlements or trials.
Everybody who participated in this process needs to be held accountable.
As part of this settlement with the two counties, 3 drug distributors, McKesson, AmerisourceBergen, and Cardinal Health, will pay a combined $215 million in cash right away to Cuyahoga and Summit counties. Drug manufacturer Teva Pharmaceutical will pay out $20 million in cash by the middle of 2021, $5 million of that by the end of this year. Teva will also donate $25 million worth of medication to help fight addiction.
Change needs to occur nationally. There needs to be laws and regulations in Washington, D.C. that prevent this. They need to have some teeth.
While it's not clear just yet what this money will be used for, Cuyahoga County released a plan last week detailing where it planned to direct money from previous settlements. Nearly $5.5 million will go to the county's Alcohol, Drug Addiction, and Mental Health Services Board to add residential treatment beds, among other things. $3.5 million for Children and Family Services to help mothers and newborns with chemical dependency problems. $2 million to St. Vincent's Rosary Hall, $2.7 million to Metro Health to treat addicted inmates at the county jail and create a federally licensed treatment program, and additional money for hospital emergency rooms in Cuyahoga County. As for this settlement, leaders say more needs to be done, but this is a start.
It's definitely not adequate for all the things that need to be done to fix this problem, but it goes a long way. It gives us hope.
And the 5th defendant in this lawsuit, Walgreens, did not settle. Attorneys for the plaintiffs say it will be included in the next phase of the trial, which is set to take place early next year, involving other retail pharmacies and drug manufacturers. Live in downtown Cleveland, Olivia Fecteau, News 5.